this eye discomfort, ignore it and your vision could be at risk. But with just one thing, you don't have to live with it anymore. Hi, this is the PillMuse channel. I'm a pharmacist working at a local pharmacy, and I've seen many people try to deal with this eye discomfort just by using artificial tears, and then end up simply living with it. That discomfort? It's actually dry eye. But dry eye isn't something you can fix by just adding more tears. If you take care of this one thing, it can get much better. Sad how many people suffer for a long time just because they don't know what that is. That's why I made this video, to clearly explain what that one thing is, and how to manage it in the simplest way I can as a pharmacist. Please watch till the end. This video might truly improve your quality of life. Let's get started. Ever feel like your eyes are burning, stinging, or constantly irritated, but the drops you keep using just don't help? That's because dry eye isn't just about having too little moisture. In many cases, it's about poor quality tears or imbalanced tear film layers. That's what I meant earlier. The one thing we must manage to actually solve dry eye. That's why your eye needs more than just water. It needs oil, mucin, and proper balance over time. So how do we manage it? To understand that, it helps to first know a bit about the tear film structure. Don't worry, I'll explain it simply. It's really not hard, so please keep watching. Let's get nerdy for a second. Your tears are made up of 3 layers. A mucus layer that helps tears stick to your eye. A watery layer that hydrates. An oil layer that prevents evaporation. When any one of these layers is off, say your oil layer is too thin, your tears evaporate too quickly. That's called evaporative dry eye, and it's way more common than you think. Starting to see the picture here? Yes, just managing the oil layer well can help solve and control most cases of dry eye. So how do we manage it? That's what I'll cover in the next part. What actually causes problems with your oil layer? That's something I always tell my patients. Know the enemy and know yourself, and you'll win every time. You need to clearly understand the cause to treat it properly, so please pay close attention. First reason is that your oil layer isn't being made properly. The oil in your tears comes from tiny glands in your eyelids called Meibomian glands. These get clogged, inflamed, or just sluggish, which happens with age, screens, or makeup buildup. You don't get enough oil. Result? Your tears vanish too fast, your eyes dry out, and no amount of watery eye drops will fix the root problem. This is why Meibomian Gland Dysfunction, MGD, is now a leading cause of chronic dry eye. The second reason is something other than oil production problems from MGD. Let's name a few culprits. A long screen time, blinking less dries your eyes faster. Contact lenses can disrupt the tear film. Autoimmune diseases like Sjogren's. Antihistamines, antidepressants, and even birth control pills. Blepharitis, eyelid inflammation. Sometimes it's even postmenopausal hormone shifts. It's not just one thing, it's a mix of factors. Now we're at the core of today's video. We've talked about what causes dry eye, or more specifically, what disrupts your tear film layers. Now let's see how to manage them. First, let's start with medications and supplements. Use lipid-based artificial tears. Not just watery ones. Omega-3 supplements, they improve tear oil quality. Both of these help support the oil layer. If you're not taking omega-3s, I highly recommend them. They don't just help your tears, they also calm inflammation and support overall health. So yes, please take omega-3s. It's a small investment for your health, but one that really pays off. Next, some helpful lifestyle habits. Warm compresses to unclog and stimulate those oil glands. Blink consciously during screen time. Clean your lids with gentle scrubs like hypochlorous acid sprays. I know some of these habits might feel like a hassle, but each one adds up, and this is how real health is built. Start with just one. Start today. And that's not all. Especially if you've tried everything and nothing helps, see an eye doctor. You might need prescription anti-inflammatory eye drops, like cyclosporin or lifitegrast, or other in-office treatments. So that's our look at dry eye. To sum it up briefly, if your eyes always feel dry, it's not just dryness, it's a tear film imbalance. Artificial drops alone often don't work because they don't treat the root cause. With the right strategies, you can fix it and feel real relief. Here's what I always tell my patients. Health isn't everything, but without it, everything is nothing. Subscribe, like, turn on notifications, and keep watching this channel. Every bit of knowledge brings you closer to taking control of your health. And if you'd like to see an alternate version of today's video, featuring different cuts of the visuals used, check out my Patreon.